Hi everyone, my name is Maiko Morotani. I'm from Nexus Motion. I'm a physical therapist in Los Angeles area. Just a couple days ago, the legendary Dr. Shirley Sahrmann was very kind to spend nearly 3 hours with the Japanese physios in a free webinar that she offered. She spoke about physical therapy history and the current problems that we're still facing, and what we can do to continue bettering our profession. Although the message may sound just specific for physical therapists, I think her philosophy, her passion, her energy, and her curiosity those are just a few examples that no matter what your profession is, there's something that we can learn from an individual who has experienced the majority of the profession's history and who excels at what she does. It's funny, I always think of Shirley every time I watch that documentary, Jiro Dreams of Sushi. And believe me, I have watched that documentary many times. There's a lot in common between that sushi chef and Shirley, although Shirley does not eat sushi. I think it's the continued pursuit of excellence. That's the common factor in those two. But anyways, I have edited the video so that you don't have to sit through the Japanese translation portion. And I will do a brief introduction of Dr. Shirley Sahrmann, and we'll get right into the lecture. So please enjoy. Dr. Shirley Sahrmann is a professor emerita from Washington University in St. Louis, program in physical therapy. She is the author of 2 best-selling textbooks in physical therapy. And one is titled Diagnosis and Treatment of Movement Impairment Syndromes. And this one covers the lumbar spine, hip, and shoulder. And then the following textbook, The Movement System Impairment Syndromes of the Extremities, Cervical, and Thoracic Spines, basically covers the other regions that were not covered in the first textbook. In 1986, she was named the Catherine Worthington Fellow from the APTA. And in 1998, she received the Mary McMillan Award, which is the highest honor of the association. And I'm not kidding when I say she is a worldwide lecturer. I think it's hard to find a country that she has not been to. So she's still sought out highly after all these years. And what I mean by that is this year this is her 62nd year as a physical therapist. And actually next year in 2021, the American PT is going to be celebrating our 100th year anniversary. Right? So basically, Shirley has experienced almost 2/3 of that American PT history. So we're very lucky to be able to hear her perspective, almost walk alongside her as she talks us through the history and what we should be doing to better our very bright future.
Well, the people of Japan that are interested in movement are very fortunate to have Maiko so committed to helping to advance the profession of physical therapy and the understanding of movement. She has certainly made every effort to share the information that she's gained both in education and practice with you. And I'm
Thank you, Shirley.
So as Maiko mentioned in the introduction, I've been in this profession for over 60 years. Actually, it's pretty amazing. I've been practicing longer than Japan has had physical therapy in the country. And that's given me a perspective on how the profession started, what our roots were, and where we are now and where we need to go. So the reason why I wanted to tell this story to all of you out there is because in the profession of physical therapy is actually celebrating 100 years of its founding in the United States this coming year. And there have been many changes in the profession since that time. So amongst those changes are actually an understanding of the conditions that physical therapists treat. It's changed a great deal since the time that I started. The role of the physical therapist, what our responsibilities are, as well as the role of the physician. The other thing that's changed a great deal is the understanding of the systemic health conditions that we all face. And as I will explain, when I first started, everything was considered an acute problem. Now we know that these are chronic problems and they start early and then last throughout your life. And I think by understanding these changes, it's going to be you young people out there that are going to help to achieve the recognition that we not only need, but that's important to our healthcare systems. And I'm hoping these comments will provide some guidance to what the change should be. So this is the overview of what these proposed changes, I believe, should be. That we have currently focused a lot on treatment methods rather than understanding the underlying condition. Also, people come in to see a therapist for one single episode of a problem that's diagnosed by the physician, rather than taking on full responsibility for a body system in which they should have ongoing monitoring of the condition. And basically, physical therapy was seen as a way to treat the symptoms of this condition that the physician diagnosed, rather than we can actually treat the cause of many conditions. Also, traditionally, our treatments have been selected based on the popularity of that treatment, rather than on profession-accepted diagnostic labels of the cause of a condition. So hopefully these following comments will help you understand about these proposed changes. So when I began my career over 60 years ago, I really thought I was a medical cheerleader, that the doctor knew what was wrong, and I just had to encourage the patient to keep trying to get better, to be able to move. So I was like a cheerleader and didn't have to know too much except not to be dangerous. So the population of patients that I saw initially were people with polio. And I didn't realize at that time how easy that was as a condition to be treating, because people's muscles went away because they lost their nerve innervation. And so the muscles died and they were weak. And then the muscles that remained would pull them into a contracture. And we had to prevent the contractures and try to strengthen what muscles were left or were returning. Of course, the physician diagnosed the condition, but I'm sure any physical therapist with experience could figure out the patient had polio. But our role was to do muscle testing so that we could tell the physician what level of the nervous system was affected by the polio. And people were very, very highly skilled at muscle testing. We had inter-rater reliability tests. We had to match our supervisors. And this information was important for the physician to understand the degree of involvement of the patient. So our big form of treatment for the weakness and contractures was stretching. And also we did what we called muscle re-education, which was an attempt to encourage muscles to participate that seemed to be recovering. And then of course strengthen the muscles that remained, but not so much that they would make the contractures worse. And all of that was to then help the patients perform self-care and mobility activities. And of course, we use braces and all kinds of supports to enable these patients to be able to function. This idea of muscle re-education, I will tell you, became sort of an important concept later on when we started developing the movement system impairment ideas, as I will take you through to understand. So our education, when physical therapy first started, they were mostly nurses or women that already had a degree in physical education because, again, exercise, health, and activity were important things. A few of them even had, there were a few advanced degree programs beyond the baccalaureate. Then education went to the baccalaureate degrees, and I received an education of 2 years of basic courses at university and then 2 years of physical therapy courses. And then there were a few programs that gave certificates after a bachelor's degree. When I was in Washington University in 1956, there were 3 faculty, none with a PhD, and there was a saying that if you can't practice, you teach. So that was how faculty was viewed in those days. The science courses, except for anatomy, were all taught by science departments, not by the actual physical therapy faculty, anatomy being the exception. I had 18 students in my class. Now, just to give you an idea of how things have changed, at Washington University, there are 37 faculty, 16 PhDs, 19 doctors of physical therapy, and there are 85 students a year. It's a post-baccalaureate program, and there are 3 years of education. So the students just weren't as smart as we were, because now it takes them 7 years and it only took us 4. As I said before, education was primarily to learn enough not to be dangerous, and that most of what I learned, and I'm sure my fellow classmates, was on the job watching other experienced therapists, because we would all work in one great big room, and patients were with us for very long periods of time, all day long practically, and for months. So we could really see how they were treated by others and what the outcomes were. So just in a simple statement, our responsibilities were to treat the condition that the physician identified, whether it was the pathophysiological problem or a pathoanatomic. And in some ways, the physician really gave a very specific prescription for what was to be done. And the specificity of that prescription did vary with different physicians and different conditions. But our role was just to provide the treatment based on that prescription.